Good day, wonderful nurses and midwives around the world. Welcome to Nurse Brainy Academy. I am Nurse Brainy and you are highly welcomed. So in our previous class, we discussed on the heart. And one thing about this academy is that by the grace of God, we give simplified shortcuts to know something that students find ambiguous. We simplify it by God's grace. So today we're going to discuss on the ECG. Like I earlier told you, before you know your ECG, you have to know your heart. Many students have chatted me. If you're not in the WhatsApp group, comment. I will add you in the WhatsApp group. Now, many students have chatted me that they find ECG very difficult. You are in the right place. It will be well simplified. So before you know your ECG, you must know your heart and you must know the cardiac conducting system of the heart, made up of the SA node, the AV node, the bundle of His, the bundle branch, and the Purkinje fibers. And we discussed that in the last. Before you know your ECG, electrocardiogram, you have to know what I call depolarization. In this academy, we will bring everything down in a simplified way. You have to know what I call what? Depolarization and repolarization. Now, what is depolarization and repolarization? I want you to write down. Depolarization is simply the process by which the cardiac muscles become electrically charged. Why repolarization is the process? I want you to know repolarization as the resting phase. Now, last class I discussed about what I call systole and diastole. And I taught you in the last class that systole means contraction. SC, systole, contraction. DR, diastole, relaxation. So atrial systole, atrial contraction. Ventricular diastole, ventricular relaxation. Now, before the muscles of the heart will contract, before contraction, there must be depolarization. Before diastole, relaxation, there must be repolarization. Now, what is this depolarization and repolarization? Depolarization is how the muscles of the heart, or the process by which the muscles of the heart get electrically charged. While repolarization is the resting phase of the heart. So when there is repolarization, it leads to relaxation. Depolarization leads to contraction. Are we together? I come again. Depolarization leads to contraction. Repolarization leads to relaxation. Are we together? So, systole means contraction in the last class. Diastole means relaxation. Now, the heart cannot contract without being charged. That is why if a patient's heart rate is dropping, we use automatic external defibrillator, automated external defibrillator, AED, to charge the heart. We are charging that heart in order to what? Lead to what? Contraction. So that charge that we are giving to the heart is, we can call it an artificial depolarization. I want you to use this to understand it. So depolarization leads to contraction. Are we together? Repolarization leads to relaxation. Depolarization leads to contraction. Repolarization leads to relaxation. Now, how does the cells get depolarized? It gets depolarized when certain ions, like sodium, enters the heart, the muscles of the heart. It will get charged. It gets repolarized when potassium leaves the cell. So sodium influx or sodium entrance leads to depolarization. And depolarization leads to contraction. While potassium exit leads to repolarization, that leads to relaxation. So that means the heart cannot contract without depolarization. What? I want you to get this. You are in Nosbrainy Academy. You don't need to cram. Are we together? Depolarization leads to contraction. Now, I want you to hit the like button so that more students will see this and also share to your classmates. Now, if you want to join the WhatsApp group, notify me. So share the video and hit the likes button. Now, we will dive into what I call Nosbrainy shortcut. Now, before you switch on your bulb, your hand must go to the switch and press it before the light appears. Now, the process by which you move to the switch button to press on is depolarization. When the light comes in the bulb, it is contraction. When you switch off, it is repolarization. And what will happen to the bulb? The light will off. It is relaxation. So there will be no contraction without depolarization. That means depolarization leads to contraction and repolarization leads to relaxation. So that you're switching on is sodium entering into the cardiac muscles that leads to depolarization. When you switch off using Nosbrainy shortcut, it is potassium leaving the cell, leading to repolarization that leads to relaxation. Having noted that depolarization leads to contraction, when you depolarization using Nosbrainy shortcut, go into your switch button to on and off. Depolarize or liberalize. The switch button is depolarize or repolarize. The light coming is contraction. The light off is relaxation. So when you switch on your button, the bulb, when you switch it on the switch, it is cardiac sodium ion entering into the cardiac muscle. That is depolarization, leading to light coming, which is depolarization. Really, Academy, you are here to learn. And by the grace of God Almighty, you learn as knowledge, not as cramming. Whenever you hear the word depolarize, you should know what we are talking about. Now, I have with me a bulb, a lamp, 100 watts with the button, which contains the switch on and off. Now, this using Nosbrainy shortcut, this on and off is the depolarization button and the repolarization button for this. Now, the process, this is the heart in Nosbrainy shortcut. The process by which this becomes on is contraction. When it is off is relaxation. So our on button is our depolarization button, and our off button is our repolarization button. So now I want to depolarize. I believe you understand what I'm saying now. So I want to depolarize. Now I have depolarized. The process by which this comes is now contraction. So when you hear the loop of the heart, there is an initial depolarization and repolarization that is going on, whereby sodium enters and potassium leaves. Now, I want to repolarize using Nosbrainy shortcut. I want to repolarize. Now, this is the heart relaxing to accept blood. Depolarize, repolarize. Contract, relax. Contract, relax. Depolarize. Having noted this, remember, atrial systole is atrial contraction. Make sure you follow the last class. Atrial systole is atrial contraction. So what is atrial depolarization? That means atrial depolarization leads to atrial systole. Now, P wave in the ECG is atrial depolarization. So this is now showing whether the heart will contract or is not contracted. So when there is an absence of this P wave, it shows that there is no atrial depolarization. But in a normal human being, the atrium must contract, so there should be P wave. Now, nurse brainy shortcut. Make sure you like, comment, and also share this. Make sure you share this so that many students will get notified and learn. Now, nurse brainy shortcut. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T. Yo, don't cram it. Many students are trying to cram it. Is it P coming before S? Is it S coming before T? Now, it's just your alphabet. Many students don't know this. It's just your alphabet, P, Q, R, S, T. And sometimes we do have U. Are we together? So don't forget it once you are in the hall and you are trying to remember your alphabet, and it starts with right. P wave stands for atrial depolarization. On your screen, P wave stands for atrial depolarization, and the normal duration, write it down, can come out in your exam. The normal duration is less than or equal to 0.12 seconds. Right? These are important things that come out in the exam. So it means that the atrium contracts to push blood. Now we have the atrial depolarization, we have the QRS. Now the QRS, we understand the number one, P wave, atrial depolarization, which leads to contraction of the atrium. And it is showing in the ECG whether the atrium is contracting or not. Now, after the P wave, the next is the QRS complex. From the word complex, it's not just one. QRS complex. What is QRS complex? It is ventricular depolarization. When the ventricles contract, depolarize that leads to what? Contraction. So QRS is a ventricular contraction. Then T is ventricular repolarization. Are we together? So we have P wave, atrial depolarization, QRST, ventricular depolarization, then T, ventricular repolarization. So we have depolarization, repolarization. When you in the exam hall using those brainy shortcuts, already counted the A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, starting from P, P, Q, R, S, T. So you are taking what? P, Q, R, S, T. So now, P, atrial depolarization. So we're QRS complex, ventricular depolarization. T, ventricular repolarization. So we have depolarization, and repolarization. Depolarization P, that's atrial depolarization. QRS, ventricular depolarization. Then T, ventricular repolarization. Now, the atrial repolarization is silent. It is not being shown in the ECG. The ventricles are bigger. That is why it shows in the ECG. The depolarization of the ventricles and the repolarization of the ventricles. But what shows about the atrium is depolarization. So we have depolarization, repolarization, contraction, relaxation. In your exam,